At Griner Bio 1, our focus is on safety. This video illustrates the proper use of the Vacuette Safety Blood Collection Set. The device is designed for your safety and is available in various needle gauges, tubing lengths, and holder options. Safety features of this device include in-vein activation to reduce needle stick risk by securing the sharp at the venipuncture site, an audible click to assure the user that the safety lock has been activated, complete control of needle retraction from the patient's vein. Now let's demonstrate the use of the Safety Blood Collection Set on a patient in a clinical setting. Prior to assembly, apply the tourniquet, place the patient's arm in a downward position, and cleanse the site with 70% isopropyl alcohol. Allow the alcohol to dry before performing the puncture. Performing the puncture before the alcohol is allowed to dry can hemolyze the sample and cause discomfort to the patient. If collecting blood cultures, follow your facility's protocol for proper site preparation with an appropriate antiseptic. Next, remove the device from the package by tearing the notched edge at the "Open Here" marks. Remove the device from the package. Unlike other winged collection devices, the tubing on the Vacuette Safety Blood Collection Set does not retain its coil, making its use and disposal easy and safe. Remove the protective sheath from the lure adapter and thread it securely onto a Vacuette tube holder. A syringe can be attached after removing the lure if that is the preferred collection method. Vacuette Safety Blood Collection Sets are also available pre-assembled with holders. Immediately prior to needle insertion, remove the protective shield from the needle. With the thumb of your free hand, pull downward from below the puncture site to anchor the vein and stretch the skin. Inform the patient of the imminent stick and, with bevel side up, insert the needle into the vein at a 30-degree angle or less with a steady advance. Once the vein is accessed, a flash of blood will be visible through the translucent shield. If a winged blood collection set is used and a coagulation specimen is drawn first, a discard tube, a no additive or coagulation tube, is recommended to be drawn first to ensure the proper anticoagulant to blood ratio. Put the first tube to be filled into the tube holder and advance it onto the interior needle so that it punctures the stopper and blood enters the tube. Hold the tube in place by pressing it with the thumb to ensure a complete vacuum draw. Underfilling tubes may affect sample integrity and alter test results. If possible, the tourniquet should be released upon venous access to prevent hemoconcentration. After the tube has been filled, remove it and immediately invert it several times so that the blood properly mixes with the additive. If multiple tubes are required, insert the next tube according to the proper order of draw and repeat this process until all tubes are filled. When all samples have been obtained, place a gauze pad over the insertion site without applying pressure. Hold gauze in place while securing the wing against the skin. Gently release the locking mechanism with the other hand by squeezing the hub and retract the needle until an audible click is heard. After the needle is retracted, apply pressure to the puncture site. The Safety Blood Collection Set is now fully and permanently activated, protecting the user and all waste handlers from accidental exposure. Discard the entire assembly into a sharps container. Once bleeding stops, apply a bandage to the site. To summarize the use of the Vacuette Safety Blood Collection Set, apply a tourniquet above the intended puncture site. Cleanse the site with the appropriate antiseptic. Thread a tube holder onto the lure. Remove the protective shield. Anchor the vein by pulling from below the intended puncture site with the thumb of your free hand. Insert the needle at a 30-degree angle or less with a steady advance. Insert the first tube into the tube holder and allow it to fill. Release the tourniquet once blood flow is established. Remove and invert the tube. Repeat with other tubes as needed. Place a gauze pad over the insertion site without applying pressure. Hold gauze in place while securing the wing against the skin. Activate the safety feature by squeezing the hub. Retract the needle into the shield until click is heard and apply pressure to the puncture site. Discard the device into a sharps container. Once bleeding stops, apply a bandage to the site. Thank you for choosing the Vacuette Safety Blood Collection Set.